Nowadays, many people have this misbelief that the teeth whitening means getting your teeth clean. But the teeth whitening is actually changing the color of the teeth. First precaution that we have to take whenever we think of the teeth whitening is meeting the right person. As a professional, you are licensed to use the peroxide to a certain level or to a certain percentage, which is actually going to make a difference to the color of the teeth. Well, teeth whitening treatment is actually the treatment that involves changing the color of your teeth. Nowadays, many people have this misbelief that the teeth whitening means getting your teeth clean. But the teeth whitening is actually changing the color of the teeth. And nowadays, since we have these HD cameras in our hands all the time, the desire to get the teeth whitened has tremendously increased, especially in the last 10 years. Mainly people are more aware of a lovely smile. They know the importance of a beautiful smile. So the teeth whitening as a treatment has been, asked by the dentists quite a lot these days.
What are the teeth whitening options?
Well, there are mainly two options. When we talk about the professional teeth whitening options, we have in-surgery teeth whitening, which is the teeth whitening that's performed by the dentist on the dental chair. The second option is a home whitening kit, which is done by the patients at home. The dentist will take your scans or molds and they will customize the whitening teeth trays for you. And in the trays, you will be provided some whitening gel. The good thing about the home whitening system is you can control your color. So if you have a desire of changing like 10 to 11 shades lighter, you want to have veneer softer, and you want to completely change the color of your teeth, having a home whitening kit and using it for approximately 10 to 14 days is risk-free, and it's as well as a great controlled teeth whitening treatment.
How does teeth whitening work?
Well, the teeth whitening, scientifically, if we say the teeth whitening, there's a chemical that we use which is a peroxide. Either it's used in the form of hydrogen peroxide or it's used in the form of carbamide peroxide. What happens that when this hydrogen peroxide or peroxide, let's say, comes in contact with the environment in your mouth, on your teeth, it breaks down into oxygen and water. So this is the oxygen that invades through the porosity of your enamel and makes the surface of your enamel looks whiter. So that slab of the enamel sometimes have impurities. So the teeth whitening and hence the oxygen breaks down those impurities and makes the color of your enamel or the color of your teeth whiter. If we talk about the safety of the teeth whitening, if it's done by a dental professional, by a dentist or a hygienist or a dental therapist, it's absolutely safe. Because first precaution that we have to take whenever we think of the teeth whitening is meeting the right person, meeting the professional. Get your teeth examined, make sure they're aware of your health of the enamel, your age group, your food habits, how healthy your enamel is, if you have any fillings, if you have any crack lines, if you have any crowns, veneers, because the teeth whitening does not whiten the artificial surfaces, which could be fillings, veneers, crowns, etc.
How effective are over-the-counter teeth whitening options?
Well, when we talk about over-the-counter teeth whitening options, we are talking about the toothpastes or maybe the powders or maybe the strips, etc. Well, these things, they're actually not as efficient as the professional teeth whitening, because as a professional, you're licensed to use the peroxide to a certain level or to a certain percentage, which is actually going to make a difference to the color of the teeth. Whereas if we talk about over-the-counter things, for instance, whitening gels, whitening strips, the percentage of peroxide is negligible. We're not allowed to sell these kind of peroxides over the counter. When we talk about the aftercare of the teeth whitening, this is basically a slight tweak in your food habits, because these are the food particles that we eat or we drink that stains the color of your teeth. So once you got your teeth whitened, we advise the patients to use Sensodyne or any teeth whitening toothpaste if they are using should have some fluoride in there, because most of the patients, they get some sensitivity after the teeth. Or you visit your hygienist every 6 months, you use some form of teeth whitening toothpaste to make sure the stains of your teeth are removed, because this is actually the staining that makes your teeth whitening diminish with time.
How often the teeth whitening should be done?
If we talk about the in-surgery teeth whitening, because in the in-surgery teeth whitening, the percentage of the peroxide which is used is higher, then you can repeat that every 12 months. Again, it depends on the habits or the food habits of the person and how they maintain their oral hygiene, because all we want to do here is want to keep our teeth stain-free. So if we are managing that, then once in 12 months is okay. If we talk about the home whitening kit, because we are using a very less percentage of peroxide in there, so that means the chemical which is going on your teeth is lesser, You can repeat that every 6 months. Or if you're going on an occasion, it's a party, Christmas, etc., you can do it for a couple of days with your home whitening kit. So somewhere between 12 to 18 months is the duration that your teeth whitening can sustain itself. Well, of course, terms and conditions apply depending on your oral hygiene habits.
Do the teeth change color as we grow?
Well, that is a very commonly asked question, that my teeth are getting yellow as I'm growing, which is really very common, especially in women. Because as we grow, there is a bit of loss of enamel naturally. It's like how the elasticity of the skin changes. The same way the enamel texture changes as we grow. So it becomes quite important that we indulge in some form of teeth whitening after the age of 40, especially for women, because we tend to lose enamel more with a higher speed because of the changes in saliva. So yeah, the color does change as we grow.